Well, tonight, Arizona still on pause when it comes to our coronavirus outbreak.
As cases spike here, the governor adding extra steps to help curb the spread. Starting at 8 o'clock tonight, the governor's new executive order goes into effect, closing bars, gyms, water parks, tubing, and theaters. For the next 30 days, hospitals can now also activate their crisis care plan, and the start of school, or at least the opening of school buildings, will be delayed until August 17th. ABC 15 taking action for you with team coverage, and let's begin with ABC 15's Zach Crenshaw. Zach?
Steve, many people were wondering when this was going to come, given our massive spike in cases over the recent weeks. And last week, we saw Governor Ducey not making any major changes. But today, he followed the lead of fellow hotspot state leaders, Florida and Texas, and ordered bars to be shut down tonight at 8 p.m. in a matter of hours. But Governor Ducey also going a step further than just bars and ordering closed gyms, nightclubs, movie theaters, water parks, and even tubing. The governor acknowledging there have been many videos of people ignoring the guidelines and gathering for pool parties or at clubs or even on rivers, as we saw going tubing this weekend. He said this has likely contributed to Arizona's spread of the coronavirus. Now, ahead of this 4th of July weekend, he also put restrictions on indoor and outdoor gatherings of more than 50 people, but said this will not impact political rallies or church gatherings, citing people's constitutional rights. Now, pools are also impacted, private and public pools. They must prohibit groups larger than 10 from gathering. Now, many people are wondering why it took Governor Ducey more than a month after his stay-at-home order expired to put these restrictions back in place to prevent this spread. This is what he had to say.
We do want to open our economy. We just want it to be safe, and we want it to be successful. With what we saw with the numbers and the spread, we had to adjust this. And like I said, this was not all. This was some. But the only way to fix it was through executive order and enforcement.
So let's talk about enforcement. That will be left up to local law enforcement. Police departments have continued to say that they prefer education to citations, so it will be interesting to see how that plays out. Governor Ducey answering my question today by saying law enforcement is not afraid to issue citations when necessary. 8 p.m. tonight, though, guys, there are going to be a lot of businesses closing. That means many more employees heading back to furlough or back to the unemployment portal with DES. Live tonight, Zach Crenshaw, ABC 15, Arizona.
Tonight, the state health department giving hospitals the green light to activate crisis care plan standards, which means the hospital chooses who gets what kind of care. ABC 15's Nicole Grigg is live with that part of our coverage now. Nicole?
And Steve, look, this is the place doctors do not want to go, where they could essentially have to decide who lives and who dies. It's all based off of math and algorithms. Now, this is the state's new crisis standards of care plan. It's a 14-page document that says hospitals have the ability to use a type of scoring system to determine who gets what type of care. It's all based off math and color codes. The state saying today that not all hospitals are at this level, but the ones that are, they can move forward with this unified plan. Dr. Chris saying that they have also asked for help from the feds for medical assistance in terms of staffing for hospitals. They're also working on a national contract to provide more staffing. Here's my exchange with State Health Director Dr. Kara Christ. Couldn't this have been avoided? Isn't this where we did not want to go?
A lot of states actually have activated their crisis standards of care plan, so it gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those. The other thing that it does, though, is it also gives their healthcare workers some liability protection as well. So not all of our hospitals actually meet crisis standards of care just yet. So it was a proactive step by our hospitals.
So again, Dr. Chris saying not every hospital has to implement the crisis standard of care plan at this time, but the ones that need to, they can, as all hospitals are at different levels right now. We're also learning that the state is closer to finding a contractor to open up and run St. Luke's Hospital here in Phoenix. This would likely now be a step-down facility and not necessarily for treating COVID-19 patients at this time. Reporting live in Phoenix, Nicole Grigg, ABC 15, Arizona.